A lot of our patients, with stress with work and from family, kids, a lot of our patients, they are, pretty heavy grinders. You can just tell by the x-rays, their teeth are just flat. A lot of grinding going on. Their teeth just get shorter and shorter. And then with some patients, don't have any symptoms, no pain, no problems, just a smaller flat teeth. Or some patients have a lot of aching around the jaw right here. The jaw is right here, and then with patients who are constantly clenching your teeth, grinding your teeth, these muscles gets activated. And when those are activated for hours and hours at night, they end up getting headaches, migraines, a lot of tension going on. So a lot of times we tell patients, the best procedure for that is the least invasive, is just to have a night guard, a custom-made night guard that fits to their mouth and teeth, and normally that helps them. Many patient comes in, they don't like it, they don't want to wear it, they have a hard time wearing it at night, they spit it out. But over time, we encourage them to keep on wearing it every night, every night. And over time, patients come and say they can't live without them because the pain is gone, the soreness, the tension is gone. And then other patients, they know that their teeth are getting shorter and shorter and shorter, so they know that night guard is a good protective for them, and they can't live without it too.